Okay, welcome everyone to Network with Pride. My name is Jenna Campolita and I am the External Relations Coordinator at the Career Center at Hofstra University. And I just wanted to thank Northwell Health for joining us today. I'm so thrilled that you were able to come today. And this is a wonderful program where many of you, I see some of the attendees today that you've maybe come to some of our previous Network with Pride programs. But if this is your first time, this is a new program that we've launched since we've gone virtual, where we still want you to build your connections and stay engaged with all of our employer partners who are recruiting talent at Hofstra. So this is a great way for you to listen in on an informational interview that we do with a professional who shares information about your career development, job search advice, recruiting opportunities, and more. And we're thrilled to have partnered with the Graduate Business Career Relations for this program. And thank you for coming today. So we are still open and available to you. It's summer semester, but the Career Center, we are still moving along. And if you would like to schedule an appointment, you can do that through Connect. And you might want to mark your calendar for Network with Pride. Every Wednesday, we have a different company, so you could see a few coming up. So next week, we have the Child Center of New York. We have L'Oreal on June 24th and Horizon Media on July 1st. And Chanel was moved to July 8th, so keep that in mind. And just breaking news, we have National Australia Bank on July 15th. So you can check out Handshake for the Zoom links to register and find all of our info. And if you are staying engaged online, check out our social media platforms. I know on Instagram, we just launched an IGTV channel where we're having different topics, where we have one of our experts in the Career Center speak on a topic. So you might want to check those out and follow us. So today, thank you, Briana, for joining us. She's the Associate Talent Acquisition Specialist at Northwell Health, and she got her Bachelor of Science degree in Community Health from SUNY Cortland. So she's going to fill us in today on her career path, advice that she has for young professionals trying to break into the field, and some quick breaking news on a new potential certificate program that Northwell Health is launching. So without further ado, I'm going to stop the share. And for those of you who are joining, if you want to make your video open, that's great. If you're not comfortable, that's fine too. But please feel free to utilize the chat feature during our talk, since if you may have questions that come up, and you can put those in the chat. And at the end, we'll take some time to address some of those questions. But again, thank you, Briana. So how about you kick off by telling us a little bit about your own career path and how you got to where you are today?
Yeah, absolutely. So hello, everyone. So good afternoon. And, Jenna, I want to thank you so much for inviting me here today. I hope that you all find me pretty informative. I'd like to say that when you leave here today, not only about Northwell, do you know more about my career path and what we can offer, but for whatever, avenue that you're deciding to take after college, that this was informative for you. Like Jenna had mentioned, I did go to SUNY Cortland. I graduated in 2016 with a Bachelor of Science in Community Health and a minor in Sociology. Fun fact, I actually went there, I wanted to be a health teacher, a high school health teacher. And my senior year, I changed my major to community health. And I'm very happy and lucky that I did, because then I got my internship here at Northwell. So Northwell is actually the only company that I've ever been with since graduating. I was an intern in the talent acquisition department. So I had a unique opportunity to kind of do a rotational program. So I was able to see the many areas of talent acquisition and HR, which I know coming out of college, I really wasn't aware of all of the opportunity within human resources. And speaking to some of my colleagues, some students, I think that when you finally get into a company, you're able to see really what's there. I know for me, when I thought of human resources, I thought hiring, firing, and a little bit of employee relations. But there's really so much more. There's so much more. There's campus recruitment, which is what I do and what I was lucky enough to get into. There's candidate engagement. There's just many different avenues that you can get into. So after interning, I was lucky enough to be brought on by FlexStaff. So I'm not sure if any of you are familiar with FlexStaff, but that is a division of Northwell Health. That's a temporary staffing agency. So because we are such a large organization with 73,000 employees, covering a lot of property between Westchester, the city, the boroughs, Long Island, we created our own in-house temp agency. So you can be hired through FlexStaff and you have temporary placements and assignments. There's moonlighting, which is a division where mostly clinical professionals, so such as nurses, you can pick up some extra shifts. And then there's also the clerical side. So I was an admin support associate, and I was supporting workforce readiness. In November of 2016, I was hired full-time as a coordinator, and I held that role until this past December when I was promoted to an associate talent acquisition specialist. So as you can see, kind of in my 4 years, I've held 3 different titles, 4 if you count my internship. So Northwell is really a place with tremendous opportunity, a huge focus on your career path. So not just where you are today, but where are you going to be tomorrow, the next day, and how is Northwell going to help you achieve that? So I know for me coming into the system, that was one of the biggest things I think that drew me there and made me really want to stay within the organization. So a little bit about my role. So I do campus recruitment. I feel as though some of your names might look a little familiar. I don't know if some of you have applied to the internships, but you have probably seen my name, worked with me, submitted an on-demand video for me through Montage. So that is a big part of what I do is me and one of my colleagues on my team, we run the internship programs. So those are the programmatic summer internships. And, unfortunately, we did have to cancel those kind of for what's going on with the pandemic. But we're hoping to be back and better than ever, in October when we start posting again for the summer. I also work as a bit of a bridge between talent acquisition and our hiring needs and campuses, schools, high schools, colleges, tech schools. So I really help to kind of match the talent within you guys to our talent needs. So that's pretty much the basis of what I do. We also work with some high school programs, but really student programs, student pipeline. So whatever the definition of student that you're thinking of, I work with it. So middle school, high school, college, doctorate, master's level programs, all of that. So no, that was a mouthful.
No, that's very helpful information. And I think, seeing the Northwell Health name all over the place, it's so recognizable. It's easy to forget, 73,000 employees. There's such opportunity in a wide variety of fields. So I thought it would be helpful, since you do help with the talent acquisition, for you to speak a little bit in general about the recruitment process in terms of, what types of skills and qualifications. And I know that's a lot because there's a lot of different areas that you recruit for, but even in using, tools like Montage for students to do their recorded interviews, what are some tips and advice that you could give students when applying for positions with Northwell Health, and what makes them stand out as candidates?
Yeah, absolutely. So our recruitment process is fairly simple. So everything is going to be online. So all open positions can always be found. It's jobs.northwell.edu. So that is our career website. Also, kind of a good tip is if you're on that website looking for full-time positions, part-time positions, per diem positions, our internships are also going to be searchable. So in the same way you could type in a role that you're aspiring for, you can also type in internships. Additionally, there is a whole tab and section of our website dedicated to students. So that really is where you'll kind of find some in-depth information about the programs we offer, the internships we offer. One kind of helpful hint that I love to share with people, that Northwell has job alerts. So I'm not sure if any of you are familiar with that. But you can set job alerts and you put in keywords. So I'll use nursing just kind of as an example, right? Because that's kind of easy general word. So you can type in registered nurse. Anytime a position with that phrase, keyword, is posted, you will get an email. And then you'll be able to apply right then and there. So instead of, continuously going to the website, searching for updates, we post about 4 times a day. So it can be a lot. It can be definitely a tedious process. We kind of let the postings come right to your email. Another benefit of that is we can get up to 200 applications in the first 5 minutes of a job being posted. So this way you can kind of be one of those first people that apply. So I would definitely recommend, if you're really interested in a career at Northwell, to certainly set up those job alerts. So kind of go into the process. So you apply. Then I would definitely say you would have to give about 2 weeks to hear from a recruiter. Again, like I mentioned, 205 minutes, right? applications. The scope and the volume that we receive on some positions is tremendous. And also something to keep in mind, a recruiter could have up to 40 to 70 open positions. So they certainly have a lot on their plates. So then from there, you'll do a little phone screening. It'll be a few questions with your recruiter. If you pass, if you will, that round, most likely you will be sent to the on-demand montage. That is kind of was the way that we were going pre-COVID. Certainly since COVID has happened, that seems to be the way that we are continuing. Just for everyone's safety, it's convenient, and it really is kind of proving to be, extremely effective. So a few hints about the on-demand montage. I would definitely say be aware of your deadline. So we do find that some people get the email, they say, okay, great, but they can't do it right then and there, and don't bother to kind of skim down in the body to see when it's due by. Also be aware of time zones. Just all little things, just make sure you're kind of reading the whole thing out. Also make sure that you're looking at, sometimes we do put deadlines for when you start to when you complete it. So even if we give you 72 hours, once you start, you might only have 24 hours to finish it. So just make sure, and certainly with Montage, and that's really the only platform I can speak to because it's what we use, everything is extremely laid out, very kind of easy to read. Another thing is I think sometimes candidates are afraid to clarify, and I will be the first to tell you, and anyone in my department would tell you, we would rather you reach out to us with questions than let the deadline pass, or it's 5 minutes before midnight and you have questions. So don't ever be afraid to reach out to your recruiter or whoever you've been in contact with just to ask, clarify anything up front. It shows initiative, it shows that you care, you want to make sure that you get things right. So definitely don't be nervous to do that. From there, if you, let's say again, you pass that round, you will most likely have a live video interview. So that, I would say, pretty much follow the same rules you would as an in-person. Your dress, make sure that you are still appropriate. Also make sure that your background, isn't distracting. I know I was on an interview with someone, they had their TV on, so like right here in the corner, you can kind of see what was going on the TV. So just make sure you're aware of, what's going on behind you. Also, everyone for the most part is aware that we're home. We're maybe unable to go to a career center or a library to have a fully quiet space for you to do this interview. So just try your best. If you have a puppy who maybe barks, everyone understands the situation that's going on right now. So just try your best. If you have roommates, maybe ask them to not, come in your room or interrupt you for an hour. But again, we certainly understand that, there's babies, there's dogs, there's honking, maybe a birthday parade's going by and you have a lot of honking that's going on. So we're all aware that these are things that we're dealing with. Another big tip I would say is, when you're going on a live interview, right, we always say bring resumes, bring extra resumes for who you meet. I would highly recommend keeping a copy of your resume on your desktop so that if the person interviewing you asks you to send it to them, you're not searching through folders and going through back in emails. You can say, no problem, I just sent it to you. So again, I would really try to treat it as much as a live interview as possible. Also a big thing, and this I probably should have mentioned for the on-demand, if you do not have access to a camera on a computer, on a laptop, whatever the situation, let them know. There's nothing wrong with that. They'll do a phone interview. Maybe you can use your phone. So don't be afraid to do that, but we've had people who 2 minutes before the interview let us know that they don't have a camera. So just, again, everything, just try to be proactive about anything. Say your Wi-Fi goes out, no problem, but make sure you send an email, give them a call, and we'll be able to reschedule. You just want to make sure you're kind of nipping things in the butt, right when they happen, as opposed to waiting, delay. Kind of rule of thumb, if something happens, you don't want the recruiter to reach out to you. You want to be the person who reached out to the recruiter to address whatever had gone wrong. So final thing. I would recommend not over calling or over emailing your recruiters. I think kind of what we've seen as a team is people are lacking that in-person experience with interviewing. And that's, I think, been a challenge for both ends, meaning the interviewers and the interviewees. We're certainly trying to make the best of it. But because of that, we're finding that people are calling a lot more and emailing a lot more because they feel that they can't make an impression because they're not in person. That's untrue. You can make, an excellent impression over video the same way you could in person. With that being said, you can also make a bad impression over video the same way you could in person, but just be patient. If someone doesn't answer your first call, don't call them every 30 seconds until they call. They'll get back to you, and then maybe if it's been 48 hours and you haven't heard back, there's certainly nothing wrong with sending a quick follow-up email. So I think that's probably about our recruiting. Our onboarding process is virtual, but that's, again, very different depending on the role that you're in.
Yeah, that's helpful advice and things that we mention in our individual advising appointments with students. But, that preparation is key when it comes to getting ready to have those interviews.
Absolutely.
And I was curious, obviously COVID has impacted so many different industries, but one that comes to mind immediately would be healthcare and Northwell Health. So if you could speak a little bit about how the pandemic has impacted the organization as a whole, what you've seen in your job, and then in terms of hiring needs, are you seeing an increase in opportunities where you will need to recruit talent? And I know your internship opportunity for the summer was canceled, but you had mentioned a potential certificate opportunity coming up, and I thought maybe students would be interested in that.
Sure. Yeah, absolutely. So COVID has definitely had a huge impact on our health system. I think as much as it was a bit overwhelming, right, how fast everything came on, I think that there's changes that are being made that are certainly for the best. One that really comes to mind and stands out within our hospitals and some of our outpatient centers is tranquility tents or wellness rooms. So those are something that we're looking to keep on. It's always stressful for certainly employees, doctors, nurses, turnover and stress of the job, but as well as some patients, right? And families of patients. Sometimes having a family member or being in a hospital can be one of the most stressful times in someone's life. So these opportunities are for you to just go, relax, maybe a massage, maybe just kind of sit in a room with some aromatherapy. But anything like that. So I think that, and again, it's a small thing, but it's something that really stood out to me kind of on all the calls and hearing about all the updates. We actually, from a talent acquisition perspective, from COVID, never experienced a hiring freeze. So that was one really kind of proud moment, I think, for all of us throughout this whole situation. We were all redeployed. So I actually wasn't working in this capacity for a few weeks. We were on COVID teams. So we had refocused our efforts, but we never experienced a hiring freeze, which was wonderful. Looking forward, we are seeing that there's going to be some changes. The biggest being some practices are not ever going to go back to full capacity in office. So the virtual checkups, the virtual doctor's appointments, in certain situations are kind of finding to be very, very effective, very helpful. We've had good feedback from our patients as well as our doctors. So that right there is going to increase anything in telehealth. So telenursing, telepsychiatry, our support, our IT support, our back-end support, our emerging tech and data science, software and computer engineering. We're just going to need more people in those fields to support our new efforts virtually. Additionally, we are seeing an increase in mental health professionals kind of for our recovery model, which is now the phase that we would like to say that we are in as a health system from COVID. So there's certainly a lot of moving parts, a lot to deal with, so that PT, OT, either kind of far, all of those areas, we are anticipating an increase in. As far as some other areas, we're kind of seeing, we're still needing accountants, we're still needing financial analysts, all of those where we would be recruiting for now and kind of planning for the fall semester. Not much has seemed to change that much. But again, it's more of what's going to increase. And again, you know, right now we're really seeing kind of that that IT, that computer science, informatics, clinical informatics, all those areas will most likely see the biggest increase at this point.
And the certificate program
Oh,
that
yes.
you mentioned, yeah.
Yeah. So again, kind of as Jen had mentioned, unfortunately, you know, again, we did have to cancel the internship. So in order to not lose that engagement and make sure that we're still being a resource to really develop you kind of, you know, professionally for when you're entering the workforce, we are planning to roll out a certificate program. So that is going to have some foundation classes. So things such as patient experience, resume review, personal brand, marketing yourself. An intro on Northwell, things like that will be recorded videos that you'll be able to log in upon registering and watch. And then some live sessions. So what the live sessions will look like is those will be career-based. So they're going to be called career electives. So, you know, it could be a nurse, it could be a laboratory technologist, it could be an accountant, it could be a respiratory therapist. So we will have them in about 30 to 45-minute live info sessions. So they'll speak about their experiences in the field, opportunities at Northwell, and then we really want to make it as interactive as possible. So we really will be promoting that live Q&A, that conversation type experience. So we haven't figured out the exact number, but it will be, if you attend or if you watch X out of the total number of videos that we provide, you will be able to get a certificate. And that will be something you could put on your resume. It will be something that you will have. There will also be cohorts at this point. We're not sure exactly when we'll be offering, if it'll be 2 times a year, kind of following the semester, if it'll be seasonally. But it really should be a pretty enriching experience. I know from kind of some pre-surveys that we've done, people are fairly excited about it. So it should be really helpful. So we will be hopefully rolling that out by the end of July, and we will certainly give enough time, you know, to market, to share, you know, with the school and have you guys register. And then there will be a full calendar. So, you know, you'll make sure that you can kind of stay on top of when the live sessions are. And at this point, the pre-recordeds will just live on our portal. So you can go in and watch those at a self-paced. So, you know, I think we're pretty excited about that.
And I see there's some questions about that in the chat.
Sure.
And I love getting like the inside info. I know this is kind of, you know, breaking news that is something new that you're developing. So someone had asked if it's a free program and where they can find out information. And I'm assuming you'll have it on your website once you have everything formalized.
Yep. Yeah, we'll definitely have it on our website. I'll certainly share it with you all at the Career Center to kind of trickle down. And the registration will be, you know, very kind of clear cut. And again, then you will have full access to the calendar and the portal to make sure that you can stay up on watching and participating in the videos. And it will be a free program.
We love free, right? Everyone loves free.
Absolutely.
It's a great way for people to stay engaged with Northwell and to build up their skill set and, you know, get a sense of what the organizational culture is like. So someone also asked, you know, given the number of applications, because I know you mentioned sometimes you get a position, 200 people plus apply, you know, what would be your recommendation for the best way to stand out in the application process?
I think that's a great question, and it's certainly something that we see a lot. So one of the biggest things, and you know, I will kind of preface by saying it definitely depends what your field is, because there are certainly things depending on the area that you're in that you can include. But generally speaking, if you've done any internships, any clinicals, really anything outside of your classes. You know, again, your internship might be required for your major, but that's still something extra as opposed to just sitting, you know, in a classroom and learning that way. Make sure you include everything that you've done. So a big thing that we do in resume when we're kind of searching and sourcing is we will open a resume, Control F for the word or keywords, and hope it pops up on your resume. So, you know, make sure that you're including, you know, even if you spent a week, you know, I'll use accounting, right? Shadowing an accountant, but that's a field that you're interested in. Make sure you put it there, because then if we search for accountant, it's going to pop up. Anything, any experience, anything that you participated in or, you know, went above and beyond for an experience, add that. That's making you who you are going to be professionally, and we wouldn't want to miss that. So certainly, you know, don't be afraid to put everything that you've done. We like to say that the resume is kind of your ticket. into the interview, and then you get to sell yourself. So I would say also a lot of people do put, I won't say a lot of people, but we do see people put pictures or other cartoons or make it, flashy. We understand what you're trying to do, trying to make you stand out. I would say though that would deter you. It kind of takes away from the content of the resume. You really want it to be impactful. If you're going to have an objective, one sentence, when it's a paragraph, I know recruiters who won't even bother reading through the rest of the resume. Like I said, recruiters could have 40 to 70 open positions at a time. So, quick, you want to make sure you have your highlights. A big thing, and this might sound silly, make sure you have your phone number and your email. I can't tell you how many times I see a resume, but there's no way for me to get in contact with the person. So as silly as it seems, sometimes people are so worried about making sure their content is correct and the margins and it's fitting on one page, right? And all of these things. Make sure you have a way for us to contact you. Make sure your name is clear. Your name is big and bold at the top. And then certainly when you get into the interview, a way to stand out is really to let someone know that, as silly as it sounds, you're human. You're human, that you're someone that wants to come to work every day, wants to help, and someone that the interviewer would want to sit next to every day and say good morning to every day and work with. So definitely not to, be shy to show who you are.
So there's another question that came in from a recent Master of Healthcare Administration graduate, and it was about full-time opportunities in a hospital setting. And do you find that hospital opportunities are harder to come by than other office setting opportunities?
Yes and no. So I would say that the hospital opportunities would be directly correlated to the size and scope of the hospital. So if you are looking for, say an administrative position in one of our smaller community hospitals, there is just going to be less of those positions for the number of beds and the number of the employees at that hospital. If you are looking at one of our tertiary hospitals, such as Northwell University or LIJ, there's going to be more opportunities. Typically there's an administrator for a department as opposed to for the hospital as a whole. But I wouldn't say necessarily that it's harder to find them than an office setting, because some of our teams can be fairly small. So I would say that, it would be more about the area you're looking at than if it's office versus hospital. If you are, looking for, a smaller niche group or at a smaller hospital, there's just going to be less of those positions open, as opposed to one of our bigger corporate departments. For instance, marketing is a huge department that we have. Accounting is a huge department. Again, like I mentioned, Long Island Jewish Medical Center and Northwell University Hospital are our two largest hospitals, going by bed capacity. So those are just going to have, and that would necessarily even be, for an administrative or a non-clinical, that's going to be the same for clinical as well. A smaller hospital isn't going to hire as many physical therapists as one of our larger hospitals might. So it would really depend on scope and size of the site that you're looking at.
Great, thank you. And I see another question came up about updates for the fall internship program. And, will it be remote? Will it be in person? And this is a perfect segue into talking about next steps. Anyone tuned into the Zoom today that they might be able to take in applying for opportunities. So any updates about fall internships?
So actually our internships are only summer based. So they're summer programmatic internships. So that would be, I'm sure some of you are familiar with the OCIO, our corporate shared, our healthcare management program. All of those are only summer, our programmatics. As far as fall goes, typically those are one-offs that departments just, maybe a big project starts and they need some extra hands, or they're transitioning and they need some support on the back end. So we don't really know. Those kind of change year to year. Again, there's no programmatics though that occur anytime but the summer. So that would kind of be a TBD on where everyone stands. And of course, the status of, can we bring people in or not? Because some people, a little hesitant to have a remote internship just because you're not really getting the same mentorship. And we want to make sure that it's a robust experience for everyone that's committing time to us. So unfortunately, I don't really have a full answer. It would more so be, TBD depending on each department and their needs.
So that's good for people to stay connected to the website and see what announcements are being made.
Absolutely.
And There's another great question from a full-time MBA student for the fall who wanted to gain more experience and was interested in the part-time opportunities, the flex staff that you had mentioned. Is that something that they might be able to look for as part-time work?
Sure. So you also, if you're looking for part-time work, Northwell also posts directly through our temp TA many part-time opportunities. Flex staff would be more of that short stint, so more of the 1 to 3 month placements. And of course, then you could roll over, get extended, go to another assignment. But Northwell also posts part-time. In regards to flex staff, it would really depend what you are looking for. So I see, a full-time MBA student. The position would most likely be a clerical support position within a business team, as opposed to being, maybe, a part-time analyst, or something of that nature. If you're looking for, a part-time analyst, or anything of that nature, it would most likely be directly through the Northwell website. So again, flex staff is most likely, or is majority clerical support, and then clinical. So, extra nursing shifts, PCA, nursing assistants, and things of that nature. But you can certainly search. FlexStaff does have their own website, but FlexStaff positions will also come up on Northwell's career website as well. So either way, you'll be able to see all of the opportunities under both the Northwell umbrella as well as the FlexStaff umbrella.
Thank you so much. So, we're wrapping up on our time, and just for anyone who maybe didn't have a chance to ask their question or wants to stay engaged with you, I had included your LinkedIn in marketing. Would you be comfortable if they connected or sent you a message on LinkedIn?
Absolutely. I'd be happy to help. You could certainly share my email as well. I'd be more than happy to do that. I don't necessarily recruit for maybe an area that you're interested in, but I would certainly be happy to give you, as much advice as I can. And then, if anything, kind of pass you off to the appropriate recruiter or resource for you. So I'd be more than happy to be a resource for any of you.
Great. Well, for everyone listening in, I'll be emailing you after today, and I'll include Briana's LinkedIn and her email in case you want to reach out to her. And I encourage you all to tune in next Wednesday for the Child Center of New York. I think there's a lot of overlap, and either way, it's always great to engage with professionals. And we wish you were on campus, Briana, but thank you so much for your time today.
Absolutely. And thank you all so much, and enjoy the summer. And again, I'm certainly here as a resource.
All right, great. Well, thank you, everyone. I'm going to end the meeting, but thanks so much for joining us. Take care and be well.
Thank you all.
Thank you.